Good morning, Tim. My name is Paul Musila. I stand to discuss. I was requested to make a presentation about what is happening in the devolved governments. I believe by now, for those of us who are new in Kenya, you know that we have a devolved government system in the country where we have 47 counties that are actually doing the actual work in the Department of Health. And then we have the national government, which is charged with the responsibility mainly of policy direction, development and direction, and then dissemination, and also, training and standards at the national level. So I come from one of the 47 counties, that's Makueni County. I'll be giving you an overview of the county in a minute. So I think from the previous presentations, before I get specific to the county, the need is clear on the necessity for us discussing nutrition in terms of the baby, the nutrition for the mother and the baby. And the two are related, the two are linked. We can't talk about the baby without talking about the mother. For example, anemic mothers are twice likely to die in pregnancy or soon after compared to those with a normal hemoglobin. And I'll be giving you some statistics on what we have in the county in terms of anemia. And that is for Makueni counties, various studies has put it as between 40 to 55% for mothers in pregnancy. We test at first contact. We still don't have a policy for testing late in pregnancy, which is something we should quickly do because as they approach labor ward, then we should need to know if we have missed out on any opportunities. When you get babies who have been born of anemic mothers, and I'm a pediatrician, I know this is true, quite a number will be born preterm and low birth weight. That is basically below 2.5 kilograms at birth. And subsequently, we'll end up to get stunting. Stunting is one of the severest, if not the most severe form of malnutrition that afflicts our babies. And then later on, developmental delays. But this is something which we all have. And then we have evidence, enough evidence on what malnutrition does to the individual, right from birth all the way up to their potential as adults. Is antenatal MMS better value for money than IFAs? I'll leave that to the audience and future meetings for us to be able to decide. Makueni County is relatively big at 8,100 kilometers squared, with a population of 1 million people roughly, and 240,000 households spread across the county. About 20 to 21,000 deliveries per year in the county alone, and a cesarean section being 25%, a rate of 25-26%. If you look at that rate, I might pause there, it's higher than what is recommended at the WHO level of 10 to 15%. And we have reason to believe if you walk backwards to the stunting that occurs at early childhood, this girl did not develop fully. The bones, pelvic bones, did not develop fully. They will not allow a baby to pass through there. So these are things which, if we want to address them, then we have to go back to how to feed the girl child and actually how to feed the mother, that girl child, before she gets pregnant. Then our prematurity rate of 11% gets us to the next challenge. All these are tied in together. If we want to sort out that one, which contributes again to the neonatal mortality rate, for example, which we have of 26 per 1,000 live births, we need to go back to the mother and address the health of the mother. We are a food insecure county. Those of you who are Kenyans, you know what I'm talking about. We enjoy rains twice a year, in the month of March to May, and again in the months of October to December. And in between, we really don't have much in terms of rains. There's not much happening in terms of production. in the counties. We therefore are unfortunate enough to be able to have been able to report all forms of malnutrition in my county, stunting, wasting, underweight, and now overweight also in some areas with all the consequences that you know about. I talked about malnutrition among the young ones, and this is just showing us that we have made progress in terms of the stunting over the years, the last 2-3 years, but we are still not yet there because a fifth of the children, the under fives that you encounter, will be stunted, and this is permanent. I think I'm speaking to experts in nutrition. We are not able to reverse this once it happens. And then the wasting went up slightly. There was some period of drought, failed rains in the year 2022 when we were assessing that. And the underweight is still stagnant. We are not yet there. This is what I want to say from this slide. For the mother, this is anemia in pregnancy. Remember I mentioned that we test this at first contact, usually around the 3rd month, 4th month of pregnancy. And because of the increased demands as the pregnancy progresses, if we check it at the 3rd trimester or at the entry into labor ward, it will probably be more than this. Many of the mothers, yes, we put them on IFAS, but for many reasons, our studies have shown that some of them actually don't tolerate them quite well. But that's a discussion that we can have a little bit later. We, however, have opportunities, and with the devolved government, it may have its own challenges. But if you ask me, we have opportunities at the sub-county level and the county level where if and once you get good governance in place, you can actually make things happen at the sub-county level and at the county level. And I happily report that I'm happy His Excellency Mutula Kilonzo Jr., my governor, has been able to challenge us to run a one-government approach, whereby I actually should not be the only one, because I'm the minister in charge of health. I should not be the only one in that cabinet who understands what nutrition is all about. I have to make everyone in that executive committee aware of the importance of nutrition, and we have done this. We have recently sat down for me to educate my colleagues and also the county assembly on a nutrition policy that we are customizing for the county. And it's almost complete. We have had meetings in the last 2 months, and we have also discussed with my colleagues in agriculture and environment, and also drafted the One Health policy that looks at the factors that affect the health of these people, 1 million people, looking at what I call upstream indicators: food security, water and sanitation, environmental factors that will actually impact on the health of all these citizens. And if you keep down there waiting to take care of them in the hospitals, you'll continue spending resources which should have been utilized more appropriately. The people's representatives have talked about the county assembly, the elected people. If you don't involve them, they will not put in the money in the right place. They have to understand they are the ones who decide how the money is split. The basket of about 10 billion. How do you convince them that they need to put in money to nutrition? Then resource mobilization. We have actually in the last 2 years, with support from one of our partners, Nutrition International, swept, let me use the word swept, money from various departments into one kitty. If the Department of Water had some money talking about nutrition, if the Department of Agriculture had some money talking about nutrition, bring it together in a way that we have an integrated approach to the nutrition, because you don't want to touch on a small bit of the nutrition. Agriculture colleague does a similar thing, water does a similar thing, and education. Yet we can put all this money together and sit together and plan end to end as a team. And that is something we have done. I'm happy to see that we have many partners in the house. We have a desire to talk and to engage and to welcome you to the county to see how we can do it at the next level. We have a challenge. Those of us who are Kenyans, you know that the money from the National Treasury doesn't come in, as smoothly as we would want it to come. Sometimes you go for a few months without the reimbursements because it's taxpayers' money, has to be collected centrally, then brought down to us at the county. And then hopefully now we will be able, now that we are discussing what do we do next, have the baseline situation well established. This is one of the challenges that we have seen over the years. And then introduce whatever intervention we want within the existing systems. If we try to create a parallel system, it will collapse as soon as that project is done. And then have the outcomes clear from the beginning and be able to measure them as we move and take action and document everything, the successes, the learnings that we have, because otherwise it will be lost as soon as the project is done. Someone coming 5 years from today might not know exactly what happened then. Thank you.